Good afternoon. My name is Deshorna Tullock. This is my presentation on remote collaboration in evidence-based care for Capella University, making evidence-based decisions. The evidence-based practice models ensure that the latest research findings and the best possible practices are incorporated to provide the best patient care. I am proposing the Iowa model for evidence-based practice to promote quality healthcare as it involves interprofessional team formation. For the Villa Health patient to receive the best collaborative remote and evidence-based care, the nurses must work together to ensure that Caitlin receives the best care. The Iowa model for evidence-based practice is the best model to apply in the Villa Health patient as it has been revised to ensure that the evidence-based practice of the nurse is efficient in dealing with tough situations like Caitlin's. The model ensures sustainability of evidence-based practice, interprofessional change implementation, patient-centered care where the clinicians are guided through a teamwork multi-phase. Cullen 2017. The process begins with the identification of the clinical problem, which is done by the clinical trigger. The path also involves points of decisions where the clinician evaluates and gives feedback in the form of a loop while recommending and implementing a change of the practice at the same time. Dr. Copeland is collaborating remotely with other clinicians such as Rebecca Hugo to ensure that Caitlin gets the best patient care. The Iowa model is the best model in the Villa Health patient for the Villa Health patient as a clinician attending to her is collaborating remotely with other clinicians with a better understanding of the condition that Caitlin is suffering from is a rare condition. The clinician ensures that Dr. Copeland, who is attending to Caitlin, follows the correct EBP model to ensure that Caitlin's condition improves. The Iowa model can be applied in this case through the interprofessional teamwork and the teamwork multi-phase, whereby the clinician ensures that the evidence-based practice is upheld during the handling of Caitlin. The doctor seeks a lot of recommendations and answers on what should be done and asks whether whatever she is doing is right. This model will ensure that the process occurs simultaneously so that there is no point whereby the clinician will have to work by herself. It will ensure that Caitlin gets the best patient-centered care, Tabak 2012. All the care that Caitlin will receive will be patient-centered as the doctor will consult on how to improve her condition. The instance of Caitlin having red marks on her two lower ribs outline that the percussions are being done a little bit too hard. The doctor handling Caitlin appears to be concerned about the marks, and her consulting Rebecca answers her questions. She gets to learn that she is doing the percussions a little too hard. The Iowa model will allow the doctor to evaluate the care she's providing to the patient and then receive recommendations that finally help her change the way she's doing the percussions. All this outlines that the care provided is patient-centered. It is all about Caitlin getting better. The Iowa model will ensure that the clinicians work together as a team since the scenario outlines that a lot of coordination is required from the documentation to recommend the best care for Caitlin. Even though Helgo is not near Caitlin, she can offer recommendations to the doctor taking care of Caitlin to ensure that Caitlin's condition improves. The model, through the clinical trigger, will help the clinician to be able to identify the problem with Caitlin and offer the necessary attention she needs. During the evidence review phase of the Iowa EBP model, the clinician will present the evidence she has about the condition that Caitlin is suffering from to ensure that her condition is not misdiagnosed. It will maximize the effectiveness of the treatment Caitlin receives. The dissemination of the outcomes of the patient care provided will outline whether they are effective or not to ensure that they can be changed or continued. Mackley 2017. The remote collaboration in the Villa Health patient has outlined many benefits. The first benefit is that Caitlin can get help from various clinicians despite them being miles away from the physical health center. The remote collaboration has made it easier for Janice to be able to effectively manage Caitlin's condition through the guidance offered by the pediatrician and other clinicians. The doctor was even able to show Rebecca Hugo the red ribs, and she was able to offer the necessary requirements, which would see Caitlin get much better care. Secondly, remote collaboration in the Villa Health scenario has ensured that the doctor applies what she learned from her evidence-based practice. She is reminded of how to fully put what she learned into practice with Caitlin. However, I noticed a slight problem with the documentation process, as there were issues that were not well addressed in the documentation of the insurance of the parents of the patient. I would like to recommend a better interprofessional teamwork process to ensure that this is done efficiently. When that is efficient, even the patient care that the patients will receive will be much faster and better. Another challenge that I noticed in the Villa Health patient is that Janice, the clinician, was not fully aware of applying what she learned in the EBP, which outlines that regular practice will equip her to handle situations like Caitlin's.